Hi, my name is Kyle Gantt, and I'm a special education major at Clemson University. In this video, I'm going to talk about cochlear implants and how they are used in an educational setting. A cochlear implant is a device that is used to help people with severe hearing loss or profound deafness gain a sense of sound from the environment around them. This is a small electronic device consists of an external portion that sits behind the ear and a second portion that is surgically placed under the skin. An implant has the following parts: a microphone, which picks up sound from the environment, a speech processor, which selects and arranges sounds picked up by the microphone, a transmitter and a receiver, which receives signals from the speech processor and convert them into electronic impulses, and an electron array, which is a group of electrodes that collects the impulses from the stimulator and sends them to different regions of the auditory nerve. An important thing to remember about a cochlear implant is that it does not restore normal hearing. Instead, it can give a deaf person a useful representation of sounds in the environment to help him or her understand speech. These devices are amazing, and they work because they bypass damaged portions of the ear and directly stimulate the auditory nerve. Signals generated by the implant are sent by way of the auditory nerve to the brain, which recognizes the signals as sound. Children or adults who are hard of hearing can receive implants. However, children that are fitted at a very young age benefit the most because they are provided exposure to sounds during the most critical developmental stage of speech and language. Usually children are fitted between the ages of 2 and 6, but now there are cases where children receive them around 12 months of age. According to the Food and Drug Administration, more than 112,000 people worldwide have received implants. In the U.S., roughly 23,000 adults and 16,000 children have received them. In the past, children with cochlear implants begin their educations in a school or preschool program designed for the children with hearing loss, and later moved into mainstream schools. However, since more and more children are receiving implants at a very young age, they are now starting their schooling in mainstream preschools and public schools instead of attending those designed for children with hearing loss. Many parents feel that mainstream experience provides many advantages, such as the language role models offered by typically hearing children and the child's enhanced preparation for the larger world. However, it is very important to understand that mainstream placement does not eliminate the need for support services. These services include speech and language pathology, use of FM systems, and deaf education services. Other services include individual or small group instruction support, use of an interpreter, audiology services, captioning, listening therapy, and acoustical improvements to the classroom. Usually teachers in an inclusive classroom setting use a microphone in an FM setting so that the child with the implant can hear the lecture more efficiently. This piece of assistive technology ensures that the child can easily understand what the teacher is saying. Ordinarily, teachers will wear a headset or lapel microphones when using this FM system. Speakers are set around the classroom and transmit the FM frequencies to the child. Some children will even have their own headphones where they can hear the transmissions, making it possible to comprehend the class material. The successful education of a child with a cochlear implant depends on the collaboration of many: the child's parents and educational professionals and implant centers, which are responsible for the child's pre- and post-operative medical and audiological management. It is important that these parties work cohesively together so that they may achieve the best educational opportunities for the child. If they are successful, the child will be able to function in school and society as efficiently as a person with no hearing loss at all.